Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning.
Good morning, Dr. Mencia. We have a crowded studio this morning.
A crowded studio. Everybody get up and say hello. No.
Yeah, that's right. You know, we ought to have like
standing room only.
That's true. Well, they all stand
Welcome,
for you.
Dr. Mai.
Good morning. I think you guys should start selling tickets to the office here.
That's
Get a
when
line
you
going.
come, I know you're like a superstar. When you get here, the studio is crowded. They say, "Oh man, look at Dr. Mai." But the reason that so many people come to listen to him,
because he's so cute.
not only he's cute, he's
You're gonna have
tall.
ladies, the girls
he's
and
tall.
jealous. You got to stop that.
Yeah, he's tall, handsome, and then he come with his shorts.
Oh, yeah. That's a very good point.
I moved to Florida to never wear pants. So I'm always in shorts and flip-flops, and I could do it at the office, I would too, but I think you'd probably kick me out.
But what do you actually do so we know what we're going to kick out?
So
Talking about kicking.
Yeah. So, I'm a radiologist, interventional radiologist. I'm actually subspecialized in interventional radiology, and I deal with the field of phlebology, which is veins or vein disease. And so I deal with treatment of people's legs. I think it's a somewhat forgotten and not thought about by maybe primary physicians. Dr. Mencia, I think, thinks about it since I started visiting and seeing him. And I think it's something that people don't think about. And a lot of primary care physicians say, listen, you're just getting old and your legs aren't working anymore.
Absolutely.
I want to continue with that. I just had someone say to me on the phone, I think I'm getting old. I'm starting to get varicose veins. So is that true?
It's not true.
It's not true.
It's not true.
Veins can appear as you age, but the symptoms that come along with it should not be happening. And so one of the two most common things that I always hear from patients are, I can't believe there's something could be done about it, and I cannot believe the insurance covers it.
Right.
It's a medical condition. So.
And one of the main problems, Dr. Mai, you can elaborate on this, is that what we see when it comes to vein disease, that sounds cool. What we see when it comes to vein disease is the tip of, we're going to do a rap song, is the tip of the iceberg. Because when people see those little varicose veins, they have no idea what's underneath that. So why don't you elaborate on that?
So, we'll do a little quick synopsis. So basically, when patients have what's called venous insufficiency, where the veins or the valves within the veins aren't working, they tend to present with symptoms. And those symptoms start from leg pain, leg swelling, itching, numbness, cramping at night. Cramping at night is actually one of the most common symptoms that I hear from patients, that they're woken up in the middle of the night and have to walk around and get rid of those cramps. Heaviness of the legs. And then the second most common one that I always get is restless legs. They feel they constantly have to move their legs and they can't fall asleep. And people try all kinds of crazy remedies. The most common one is putting soap next to your feet and hoping that it'll go away. I don't know if you've ever read that. It's white ivory soap, right?
White ivory soap.
Yeah.
Why do they think that's going to help?
If you take the soap and you squeeze it between your feet, maybe distract her. Who knows?
But I have to say, what you just said, I've had a lot of, it's funny, I used to write a column for the Palm Beach Post, and I had a lot of letters that came in about restless legs, and people didn't know what to do, and a doctor said there's nothing you can do about it. You have to live with it. So you're sounding like that's not true.
Yeah, no, it's not true. A lot of patients come and see me actually are put on medications, and I really try to get patients off of those medications. My first step is said, stop taking this. Let me fix what's going on here. And patients are put on different medications like gabapentin, which is actually a seizure medication, and I don't think it's doing any good for them. Really, the first thing that I do when I have patients with cramping or with restless legs, I put them in compression socks. And I send them out. I said, you're going to come back for an ultrasound. We're going to work this out. Usually when they come back for the second visit, they come back and say, what are these magical socks?
Really?
What is going on here? These socks work. What's in them? How did you get, all these questions about the socks. I said, listen, it's not the socks. It's basic medical physiology. And that is by me correcting the underlying venous pressures, I'm relieving your symptoms. So that's, I make believers out of people by just giving them some
And you have those that you sell at the, don't you?
We do, because when you talk to patient and the listener out there, they probably got turned down already when they hear compression socks. They don't want to hear that. It's not those old compression socks that we have. And I usually tell my patient, on your way out, look by the door, and you're going to see the compression stocking I'm talking about. They are very different. They are colorful. They are modern looking. You can wear with shorts. They don't look bad. As a matter of fact, one of the marathon winner of the Boston Marathon, as he crossing the finish line, you see him with those compression stocking that we sell at the office.
Really?
Right. So it's not those old, ugly-looking, brownish compression stockings. Some of them are purple, pink, blue, colorful. And not only that, some of my staff, they wear the socks because we are on our feet all day. So you see some of, Oscar and some of the staff, they walk around. And when I'm talking to the patient, he always showing off, look, I have them on, look, I have them on. And they are they are colorful. It's not what people used to know as compression stocking. This is 2017 now.
So talk about the word compression.
Mm-hmm.
So what is that doing?
What compression does is basically apply a certain amount of pressure to the outside of the skin and compresses the superficial venous system. And a superficial venous system is what is usually a problem with the veins, or with the valves. And so what we're trying to do is eliminate the flow in the superficial venous system and push it into the deep system. And the deep system of veins actually does a better job of bringing that blood back. And so if you shut down the superficial system with the compression, you're actually getting rid of this abnormal venous pressure, abnormal venous hypertension to a certain degree, because obviously the socks are only so compressive. And by doing that, we're eliminating patient's symptoms, or at least improving the patient's symptoms.
So does it only happen in people's legs? Do you get people's arms that have this, or no? Is it just a leg thing?
I do mostly with people's legs, and that's just because of what physiologically we do. But we've had put people in compression. We've checked for reflux in veins in the arm, and we see reflux in patients' arms. I'm not sure if it makes any difference because people have reflux in their arms, but they never develop, the end stage of venous disease, which is ulcers, right? We're trying to prevent venous ulcers. That's basically the reason we treat a lot of individuals, or when they come in with venous ulcers. And venous ulcers are the most common ulcer in the world, by far, is venous ulcers. In the United States, I think it's something about 70% of ulcers are venous ulcers, and you have arterial, diabetic, and everything else. So we do.
So when Dr. Mencia, when you have patients, is that something when you examine them and you see this on their legs and they never complain?
Even before I look at their leg, when they talk to me, and they say, I get up and my legs are so tired. My thigh, I just feel like my thighs are burning. My calf is burning. I don't know if I have a DVT. Do I need an ultrasound? I say, I think you have venous insufficiency. Not only that, remember that the artery carry oxygenated blood. They bring the oxygen from your lungs to the tissue, like your skin, let's say. The largest organ in your entire body is your skin. So artery bring oxygen to all the organs, including the skin. And the vein take the waste material back. So you can get rid of what we call CO2, carbon dioxide. You get rid of that. So if your veins are not bringing that blood back, and that blood spending too much time by your leg, by your calf, by your thigh, this is blood that don't have oxygen. This is bad blood, let's call it. It's not the good blood with the oxygen that keep you going. So a lot of times when we help those veins bring the oxygen back, then you allow the artery to continue to pump the good blood into the tissue. And you see those patients that have bad circulation when it comes to the vein, that their skin start turning dark. And that's because of the iron that linger around the skin. They start staining. It's like tattooing your skin with iron.
This sounds terrible.
That's a very interesting point, actually.
Yeah.
And I work with a couple different clinics and a lot of dermatologists as well. And what we've noticed that, and this is a very true point, when the skin starts to get discolored like that, the brown discoloration is actually from red blood cells can't get out of your leg. they end up dying and depositing the iron in the skin. And what we do is we take biopsies of that, or we used to. I don't think we do it anymore. I think some other offices still do. At least at the places that I work at, I say, look, let's stop biopsying these people. We know what this is. But when you take a biopsy and you stand and look at it under a microscope, all it is just iron deposition. Eventually, the leg turns brown, and if enough iron deposition, I think there's enough destruction of the skin with that underlying pressures. This is why people end up getting venous ulcers.
Oh, I see. That's what that is. But, okay, so now, say you have someone. What is the process? What do you have to do to them? Do you have to inject something there?
Yeah, it's a pretty simple thing. The first thing we do, my Dr. Mencia evaluates the patients, refers them to me. We do an ultrasound to understand what the veins are doing on the inside, understand what the valves are doing and what the destruction there is. And then we do simple in-office procedures, 30 minutes. Patients come in, we do a procedure, they walk out. Literally, when I'm done with them, they walk out, they drive home. A lot of them go about their normal day. A lot of patients will go to work the same day. There's really no downtime.
We have a patient he's from Australia. And Dr. Maya and I work on his leg. And basically, he was at the very beginning stages of his venous insufficiency. And I saw him the other day, him and his wife. He goes, man, Dr. Mencia, I'm golfing now. Like, my legs are, what a difference with my legs. I can go golfing. I can, I don't have to stop. I just keep going. I feel like 20 years younger than what I was performing.
So there's no recovery time, is what you're saying?
No,
very minimal.
No, very minimal. You wear your support stack and you follow Dr. Mites and his staff instruction. We have a whole team at the center. Basically, even before Dr. Mites sees you as a patient, if you call and you say, I need to make an appointment to get my legs evaluated, they don't have to see me. If they want just to have the vein department look at them.
Of course they want to see you.
They will say hello, but if they sometimes they love their primary, and that's fine. I have no problem with that. But what I recommend is get the ultrasound first. Let them schedule your ultrasound so that when Dr. My assistant look at you, they don't waste your time. If the ultrasound is normal, everything look good, they tell you, no, it's not your vein. Your veins are doing fine. So when they call in for an appointment, the office, they can schedule the ultrasound with Dr. My staff, and we do the ultrasound. It's a special ultrasound. And mind you that I have an ultrasound machine at my office, but we do a very sophisticated ultrasound that is basically looking at the vein. Because venous insufficiency, imagine when you take an elevator from the first floor to the 10th floor.
Here he goes again. He always says this. I love this.
Yeah. So imagine this elevator, when it goes to the third floor, it drops back to the second. When it goes to the fourth, it drops back to the second. When it goes to the fifth, it drops back to the third. So the elevator is never going straight up. It goes up and drops back down. So the venous insufficiency is the blood trying to go up and drop back down, trying to go up and drop back down. And eventually, when you have so much bad blood in there, some of them get to go up there to the heart and then back to the lung.
Wow.
But there are cups in the vein that is supposed to hold that blood so they don't fall back. And those cups just become, it's like when a person get a perm on their hair and the hair is just dead and those cups just drop there like somebody getting a perm on their hair.
Okay, everybody, we don't want you to get a perm on your legs, so let's give you a phone number here. Why don't you call for an appointment? Sounds fabulous. You'll see Dr. Mencia. You'll meet Dr. Mai, and the phone number there is 954-489-1345. Again, Pencil Talk Radio. Take your pencils out, write it down, put it sticky up on the refrigerator, 954-489-1345. Now, I was curious, so you have home visits, which has always been wonderful. What if someone has this problem and they're at home? Could you do something for them at home?
Absolutely.
Can you really?
Oh, yes. The clinician that goes to the home will look at the leg, and sometimes people get misdiagnosed, which is one of the topic we want to write about on the one of the edition coming up on Boomer Time. It's about lymphedema. Sometimes people get misdiagnosed having lymphedemas, having leg edema, and it's very different, swelling of your leg, if you eat too much salt and dangle your feet and you don't move them, all of us can get ankle edema, ankle swelling. But lymphedema is a different situation, and you don't treat lymphedema with water pill. You will take water pills until the cows come home, until you kill your kidneys, and the lymphedema will not go away. And what happened with a lot of patients, let's say with lymphedema, and they have an ulcer, it will take forever to heal that ulcer. It will never heal because you are not getting the nutrients that come from your body to heal that ulcer. You are basically getting the ointment and whatever the nurses are coming over to your home to put on you. So why don't we distinguish what is lymphedema?
Let's talk about, so let me take a step back and explain lymphatic system.
Don't go back too much because the window there, we don't want you to
fall out of the building. Yeah, thanks for saving me. They were looking for my best benefit. So, we have our arteries which deliver the blood, okay, and we have veins that return the blood. And I always talk to the patients about, what the difference is. And so I always say, if you took a bucket of water and you spilled it on the floor, that's the arteries doing their work. And then you got a mop, and you mop that floor up as best as you could. That's the veins doing their work. But what do you always have a little bit left over? You got a little bit of fluid always left over, so the janitor puts up a nice yellow colored sign, says, watch out, it's still wet, right?
Yes.
So who takes care of that little bit of water that's left over? That's what the lymphatics do, okay? And so we look at the lymphatics as the small system, which is a third system of vessels. They're very tiny. And they basically pick up all the little fluid and debris and things that are left over in the body, and they bring them into the lymphatic system, and they go into the lymph nodes. And from one lymph node, there's a road to another, till it gets back up to the chest. And eventually that fluid is processed. The fluid is identified to see if there's any infections or any kind of problems in the lymph nodes. And then eventually that fluid is dumped back into the circulatory system, and it goes back, and the cells and the debris, everything's cleaned up, okay? So we actually have three systems to carry fluid and blood, and that is the arterial, the venous, and the lymphatic. In terms of arterial disease, we're pretty much on top of it as a community. We are going after arterial disease very rapidly and very quickly and with full force, and that's because if you knock off an artery, you're going to lose a toe or an ankle or a foot, right? So we know it's an emergent situation. But in terms of arterial disease versus venous disease is more of a quality of life. Your legs are going to hurt, but you're not going to start losing toes, right? So it's not as emergent. But arterial disease, as common as it is, it's not as common as venous disease. Venous disease is 5 to 10 times as common as arterial disease. So if you have one arterial patient, which we're really easy identify, we can identify them very easily, we've kind of lagged behind in arterial disease because we haven't done it as well in the medical community identifying venous disease, right? So if you found one arterial patient per year, you should be able to identify 10 venous patients. So if you have 100 arterial patients, you should have 10 times as many venous patients. Mm-hmm. And that's what we're not catching. We're not catching the venous disease, okay? So then there's a third system, which is the lymphatic system. And this is a very slow-working system. This is a system that can only manage so much fluid in a day. So this system can become overwhelmed very quickly.
Now, before you continue, because people are listening, there are people that have had breast cancer.
Correct.
And they have a very large arm. And I knew people who did the massage, the lymphatic massage. Now, it's not what you're talking about.
No, so let me explain that one. So basically, the damage to the lymphatic system can happen in different ways. People who've had breast cancer usually have lymph nodes in the axilla or in the armpit that have been dissected away. So when you remove the lymph nodes, you're basically removing these little chambers where the lymphatic fluid should be going through, right? It's almost like closing down 95. When you close 95, you're going to get traffic all the way backed up, and people are going to try to go around, and you're going to have a huge problem. So that's basically what's happening. Either radiation or surgery has removed those lymph nodes. For a good cause, obviously. We need to remove those lymph nodes, and we've got to make sure there's no cancer there, or we have to eliminate them if there is. But now the problem is you've destroyed the lymphatic system, right? You remove all of them, and so now that lymphatic fluid can't drain. And over time, patients will get horrible swelling, right? I mean, you've seen that. And the only way to pretty much help with that swelling is, one, try to reconnect the lymphatic system, which is very difficult to do, and there's some work being done on that. Some physicians are doing that. But also try to massage that fluid out of the arm. If you can push that fluid out of the arm past the lymphatics, there's going to be some other additional lymphatics higher up that are going to be able to pick up some of that fluid. So the idea in the therapy there is massage that fluid, put on a compression, right, or some kind of wrap so the fluid doesn't reaccumulate, and try to push that fluid up so the body can reabsorb it.
Is that painful for that person?
I think it's more uncomfortable than painful.
Yeah,
you know?
the extra weight.
Exactly, the extra weight and all that extra pressure. And so same thing happens in the legs, right? If you have damage to the lymphatic system, you have damage to the lymph nodes in the groin, or someone else should say you had a huge accident and there was some damage. I've had patients who come in with joint replacements where, you know, they're cut open and some of the lymphatics are damaged. Again, the lymphatics are so tiny, they're a couple of cells. They're very difficult to see, and they're throughout the entire body, right? So if you damage those lymphatics, one of the most common reasons of lymphedema is actually infection with filariasis. And we see that a lot in, obviously not in the U.S., but other countries where there's damage to the lymphatic system through this infection, and lymphatics are damaged, and patients get this horrible leg swelling. It's termed elephantitis.
I've heard of that.
And you kind of see, it looks like the leg of an elephant. It's very
like,
large.
Like the movie The Elephant Man. People will remember that movie,
The Elephant Man.
Yeah. Must be a terrible thing.
Yeah.
But so now the bottom line is, can you fix this?
You know, what I tell patients is this is a lifelong disease, but we are able to manage it. So the first thing we do is we send patients, first of all, we have to identify the disease. We have to make sure that there's nothing that could be causing it. One of the biggest causes of lymphedema is actually venous insufficiency. So we've identified now that venous insufficiency, or the abnormal pressures, which Dr. Mencia explained via the elevator method, this abnormal flow in the venous system actually can damage the lymphatics. And over time, if you have venous insufficiency and it's not repaired, can damage the lymphatics. And all of a sudden, now you're going from, you know, not venous insufficiency and the swelling, but now you're going to venous causes of lymphedema. And it's called vasolymphedema. So it's actually really easy to remember. So those are the patients I see a lot. I do have a lot of patients come see me for just lymphedema because they just don't know what's going on. They don't know. So we explain to them, so listen, let's look at the entire system. Let's look at your arteries. Let's look at your veins. Let's look at your lymphatics, see what's going on, see what we can fix, and then let's try to do something about it.
So I think what you said, Dr. Mencia, here's a man who wasn't happy, couldn't play golf, he was in pain. And with just how many treatments did it require until that happened?
I know he went a few times. Because, you know, Dr. Mike will work on, let's say, the thigh today, let the heel, work the calf, and then the other leg. So he went for a few treatments, but at the end he was treated and he was super happy. And, you know, he's not an old man. He's probably in his late 70s. He's still very active, you know. And he's so happy that he's able to go with his friend. So now he's telling his friend, go and see my doctor, Dr. Mencia, because he cured me. That's why I'm playing golf.
Well, I would think we don't hear very much about this. This is a perfect thing to do an article
and
about.
We started the show, the right thing was said at the beginning of the show for those people that tune in late. A lot of doctors will blame this on aging. Okay, it's not true. It's not true. It's not true. It's not true. Don't allow people tell you that because you are getting old, that you are having swollen leg. You know, you have to get that checked, and it's not always an arterial problem. It's always most likely to be a venous problem. And venous problem can be corrected, and you will have much better quality of life. You know, I have seen people that used to come to me on wheelchair, and they walk around now with a cane. They are more active.
It's that serious.
Yeah, it's that serious, and it's much more neglected than that. It's such a magnitude of a problem. And it's unfortunately the NIH is not putting more money into the veins that, you know, the money they are putting into the artery. We tend to divert the taxpayer money into things that we think are important without talking to the people in the front line.
Before we run out of time, I just want a quick question because you're so into exercise. Would it be good for people to get onto these bicycles, you know, in the exercise rooms? It can
harm them if you don't treat the problem. Because remember, the elevator, so if you take the same elevator that is working up to 10 flight, and you say, I'm going to put it on the Empire State Building now. When it gets to the 40th floor, it's going to drop down to the 20th floor.
Okay.
And it doesn't sound like a good thing. So when you start exercising, you are bringing more blood with oxygen there. So you can create a huge problem. and then now the lymphatic system is going to get involved. Then your legs start turning what we call calor, dolor, rubor. Calor is hot, dolor is pain, rubor is redness. That is the sign of cellulitis. So you start getting a lot of cellulitis, and that's another indication that you have a problem, most likely with a return of blood.
Okay, Dr. Mencia, we've got to tell everybody how to call you. Make an appointment, 954-489-1345. Dr. Mai will be able to help you when you get there.
You have to spell his name because we have to lady fighting.
M-A-J, right?
M-A-J.
M-A-J, Mai.
We have to lady in the waiting room fighting. I'm here to see Dr. Mai. No, he's mine. No, he's mine. No, he's mine.
Thank you very much. It's wonderful. Thank you for being here, Dr. Mai. And we'll be right back.
Really?
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.